What if a virus emerged that was not only highly contagious, but also more deadly than any strain seen before? That's exactly what we're facing with the newest, most dangerous form of Mpox. This deadly variant, known as Clade One B, is sweeping across parts of Africa and is now making its way into Europe. With a higher mortality rate and a greater ability to spread compared to previous strains, this form of Mpox is causing unprecedented alarm among health experts and authorities worldwide. In this video, we'll dive into why this variant is so perilous, how it spreads, and what you need to know to protect yourself and your loved ones. A new and deadly strain of Mpox, previously known as monkeypox, is spreading rapidly from parts of Africa. In response, China has ramped up screenings for goods and travelers from regions affected by this highly contagious disease. The World Health Organization, who declared a global public health emergency on Wednesday, warning that Europe could soon see more cases. The Democratic Republic of Congo has already reported 450 deaths due to this new strain, and neighboring countries like the Central African Republic, Uganda, Kenya, Rwanda, and Burundi have also detected cases. In the Republic of Congo, the worst-hit country, public health campaigns are underway to warn citizens about the dangers of Mpox. This virus, transmitted through close contact, including sexual activity, skin-to-skin contact, or even breathing close to an infected person, causes flu-like symptoms and skin lesions. While these symptoms usually resolve within a couple of weeks, Mpox can be deadly, especially for those with weakened immune systems. The virus can lead to severe complications, including pneumonia encephalitis, which is inflammation of the brain, and even blindness. In some cases, the virus can trigger secondary bacterial infections, which can be difficult to treat and may lead to sepsis, a life-threatening condition. The more dangerous strain of Mpox has now reached Sweden. Authorities there confirm that the person was infected during a stay in an African region, currently experiencing a major outbreak, raising alarms across the continent. Health experts predict that more European cases are likely in the near future, emphasizing the importance of global awareness. While the UK Health Security Agency states that the risk to the UK population is currently low, preparations are underway to ensure clinicians can recognize and respond to potential cases promptly. Vaccination remains a key strategy in preventing the spread of Mpox. The UK government has stockpiled vaccines as part of its preparedness efforts. The WHO stresses the importance of a coordinated international response. Two countries, Nigeria and the Democratic Republic of Congo, have been granted emergency use approval for vaccines. Nigeria has secured access to 10,000 vaccines, but the timeline for their arrival remains uncertain. The WHO has also urged wealthier nations to share treatments and vaccines to help combat the spread. The Red Cross, with teams on the ground in the DRC, reports a severe shortage of treatments, vaccines, and the ability to trace and test. Controlling the outbreak in regions like the DRC is crucial to preventing the disease from spreading globally. As one WHO official put it, "Control it where it's raging, and it won't come to you." Another unknown fact is while most people associate Mpox with the visible skin lesions, in some cases, these lesions can appear internally, particularly in the respiratory tract. This can cause breathing difficulties and lead to complications that are often overlooked, making the virus even more dangerous. We've heard that China is screening goods and people. Can Mpox be spread through goods? As far as we know, Mpox spreads primarily through close physical contact, including sexual contact, handshakes, hugs, and shared bedding. While it's possible for the virus to be transmitted through contaminated materials, like bedding, there is no evidence to suggest that inanimate objects, such as goods, can spread the virus. However, this new variant, known as Clade One B, is more infectious and deadly than the strain responsible for the global outbreak in 2022 to 2023. Given the lessons learned from COVID-19, do you think the world is better prepared this time around? Indeed, we've learned valuable lessons from COVID-19, such as the importance of contact tracing, public health surveillance, and targeted vaccination campaigns. However, the WHO has already indicated that border closures are not effective in controlling outbreaks. Lockdowns and school closures, which were used during the COVID-19 pandemic, have their own negative consequences and may not be the best approach here. Both the WHO and the Red Cross have made it clear that travel restrictions do not work. In fact, they can make the situation worse by driving movement underground, making it harder to trace and test potential cases. The WHO is expected to issue further recommendations soon, but border closures are unlikely to be among them. Instead, the focus will be on testing, tracing, and transparency. Sweden's swift reporting of its first case is a model for how countries should respond. Generosity in sharing vaccines and treatments is also crucial, particularly for vulnerable populations in affected regions like the DRC. Here's our final thought. The spread of Mpox is a stark reminder of how quickly infectious diseases can escalate. With this new strain posing even greater risks, it's crucial that we stay informed, boost our immune systems as much as we can, and make sure we are in optimal health, follow health guidelines, and support global efforts to control the outbreak. For more updates and in-depth coverage, make sure to hit the subscribe button and turn on notifications. Share this video with friends and family to keep everyone aware and prepared. Together, we can help combat this global health crisis. Stay safe and informed.